This next presentation is more so the differentials and some techniques that can actually help you with the diagnosis, because that's part of the issue in diagnosing CNS disease is the timing that we find it and then the quality of sample or what sample we actually got submitted. That's very important, and we need to think about that because it's a lot more than just grabbing something, throwing it in a box, and then poof, magic happens at the lab and you get a diagnosis and you look like a hero. All right, that's not how it usually goes, so take your time on these CNS cases and we'll actually do a lot better job. So points of understanding real quick when it comes to CNS disease in nursery pigs is that it can have many different presentations. The same bug can look different in one pig versus another. Different pathogens can look the same. So that's one thing to keep in mind. And as Amber said, everything is not strep suis. Granted, it's by far and away probably the most common in the nursery pig, but you got to be thinking outside the box sometimes, or at least do a good soap to understand what's going on. And lastly, which is probably more so a personal pet peeve of mine, is that we never do a good enough job on actually looking at what the pig is telling us. We just grab the sample, shove it in a box, and send it off. So hopefully, through this presentation, we'll understand there's potential locations for the insult, what you're seeing, and then sample submission, the differentials goes with what you're actually seeing in the individual pig. So first, real quickly, broke it down, the brain, the CNS, by cerebrum, cerebellum, and spinal cord. And just so you know, for all intents and purposes, just a refresher from your anatomy class and back to vet school, is the cerebrum actually controls behavior, involuntary movement, and consciousness. So if there's an absence of voluntary movement, i.e. probably paddling non-stop, probably the cerebrum is affected. Cerebellum is associated with coordinated movement and balance and posture. So if you have ataxia or uncoordination, that's probably involved. So you see where this is going? Spinal cord, very similar to the cerebellum, but also you get to add muscle rigidity and flaccid paralysis in there as a potential cause. With CNS disease, multiple locations can be affected at the same time. So you will see multiple iterations. If you just take this pictogram right here and just break it down like this, some diseases will affect all things, cerebrum, cerebellum, and spinal cord, such as strep suis. So you might see all different iterations of that. I know neurology is probably not everybody's favorite class, but these are some really cool words that you might use when you're on farm or submitting a diagnostic case, because it really helps us with the information that we're trying to look for. I'm just going to start on the bottom. I'm sorry I cut off on the slide here, but proprioceptive defects is basically knuckling. And if you see that, that's almost always a spinal cord issue. The most common cause would be a Selenium Toxicosis maybe, or enterovirus infection. So if you see the knuckling, which sometimes is a very key point, we can localize to the spinal cord, which then hint you need to submit. Also, if there's paresis or paralysis, that also indicates the spinal cord. But as you go up, it gets a little more confusing with ataxia, because that could be all parts of the brain, cerebellum and brainstem and spinal cord, and coordination the same. And then we get up to paddling, which is right here. Obviously, it's more a cerebrum and maybe brainstem effect. And lastly, which is another cool, important thing to note, is hyperesthesia, which is a cerebrum event as well, meaning a overreactive response to a stimulus. So if you can see that or know that, we actually know what part of the brain we need to look at or actually test for certain pathogens or non-infectious diseases. So this is, Darin's got a pretty simple mind, and I just try to break it out with some of the common things that we might see in the nursery. And I just put one across the top and so forth, down paddling, sudden death, fevers, tremors, seizures, or incoordination. And I just started listing of what are the common things we see in the nursery on the left there, and trying to figure out what just have to do with what. And when you break it all down, it looks confusing, like a checkerboard, but I think the biggest thing that I want to try to show you is that viral diseases of the CNS really don't cause a whole lot of actual padding where they're uncontrollably down and going at it, and it doesn't cause sudden death. So if you actually have CNS signs generally coordinated with sudden death, you can probably limit it to a bacterial component, maybe the meningitis, or also the edema disease. So that's my one kind of key thing that I kind of wanted to throw in there. Obviously, there's a lot of different differentials, but this is just Darin's quick chart of what he kind of sees or hears from people that with these certain differentials. So we're going to get into our differentials, and like I said earlier, and Amber alluded to, and so did Dr. Rosso, that bacterial meningitis is probably the most common. Strep suis or Haemophilus parasuis being our primary differentials. However, it should be stated that any bacteria that can cause a bacteremia or septicemia can equal meningitis. So there are some other differentials: Strep suis, Salmonella cholera suis, now Trupperella pyogenes. Those are all in there. Clinical signs may vary, but to me, to be honest with you, I usually look for multiple pigs. I look for swollen joints, and the biggest thing I look for when I'm looking for Strep suis or bacterial meningitis is nystagmus. So if they have nystagmus, that's generally a good indication to myself that it's probably bacterial. It doesn't hold true all the time, but it's a good indication other than using all of a sudden down paddling. I like to look at eyes, know if they're conscious or not. That usually plays a big role. Grossly, if you actually take the time to look at the brain, I suspect probably 1 in every 4 brains you'll actually see the meningitis if you look. Common places are actually the ventral portion of the brainstem, the cerebellum, and then the back portion of the cerebrum here in the sulci. See this white chalky material? That's actually the exudate. Nice suppurative material. In general, suppurative material also has gravity, so that's why we generally see it on the bottom part of the brain. This brings up another issue that I should point out that's probably a key note. A lot of times when you're submitting brain, we get a lot of brains where we just get cerebrum and we do not get the cerebellum or the brainstem. So if it's an acute disease, potentially strep meningitis, the lesion may be there, but we actually never got the sample to actually prove it. So be cognizant of when you're actually submitting CNS signs that you get all portions of the brain so we can make a full diagnosis. And here I'm actually going to go through a couple steps to show you how to do this that makes Dr. Rosso's and Dr. Marie in here and myself a little bit easier. I do like to mention that you can take CSF fluid prior or after death. It works well. It's sometimes difficult. A lot of times, if you get a clean sample, it's really good. I'm not going to show that. I'm actually showing if you take the head off and disarticulate, we get brainstem, and then you can see this line right here. That's the dura mater, or the meninges. If we stick our swab right as we take this off before we contaminate it, right there, sorry, my hand's a little shaky, you can actually get a very good sample prior to removing that brain. I like to get a good sample prior to that because make sure that everything lines up. If you decap or if you take the cap off the skull, you can actually take another swab as you're taking the meninges away. Usually somewhere right around there, you'll find some nice good suppurative inflammation potentially as a swab to culture. And this way we get away from searing the brain and also potentially having the correct media with those more fastidious organisms like Haemophilus parasuis. And lastly, which is my favorite, which no one ever does, is if you cut the brain in half. You have to get half the brain out. One to fix and one to formalin. They usually take their finger that's all full of manure and then try to peel it out. Well, if you take a swab and do the same thing, you can actually submit that swab as a culture, and you have a pretty good chance of finding what you're looking for. So I appreciate if you consider this. But the last thing is, when it comes to CNS disease or meningitis in particular, you actually have to send fixed tissue as well, because in a barn, contamination is pretty high, and we really like to see an isolation with a lesion so we know exactly what we're dealing with. Because an isolation with no lesions may mean we contaminated our sample. Moving on to viral CNS diseases. They're a bit fewer on the differential list, but they're There's foreign animal diseases. I just put them up here so you all know. And then there's ones in the U.S., plus or minus pseudorabies that was eradicated. But typically, these are our main differentials. And I think that what we see the most of would probably be potentially some PERS encephalitis, and then enterovirus-associated lesions, and potentially HEV in there as well. So that's kind of what we're dealing with. Again, these pigs are probably not going to be down and paddling, but they will show ataxia, generally have some potentially coma. It's hard to tell them apart, I get that, but I usually if you don't see the sudden death, that's a good thing. Gross lesions, what are you going to see if you open them up? Probably nothing. Very difficult to see any lesions. One important note, we do see enteroviruses, and enteroviruses impact the spinal cord to a greater degree than the brainstem or the cerebellum. So if you don't take spinal cord, you may not know that you're actually dealing with enterovirus infection. And that leads us into, well, enterovirus, what the heck is that? And actually, it was a big group of probably, I think it was 17 or so different enteroviruses that were broken down into groups. And then we gave them all some names, and we don't actually know what they do. But more recently, they have been designated into multiple groups now. So porcine enteroviruses, which is a picornavirus, which actually is similar to polio in humans, has now been divided in swine into enterovirus, saplovirus, and teshovirus. And what that did is most of the pathogenic enteroviruses in swine are now considered teshoviruses. And the list here is quite long, 13 of them in that group potentially, with 7 of them or so that are known potentially to cause CNS or CNS-like disease. So that just needs to stay on the radar. And the thing is, everybody forgets to submit the spinal cord when this is potentially a differential. And why? Because you can get severe myelitis. Well, so I don't expect you to know what's going on here. But basically, all the blue is inflammatory cells, and that's definitely not good when you're dealing with CNS disease. So how often do we see this? Maybe a question. There's probably one or two cases that we see every 2 months, this potential. It's out there. It's in multiple systems or multiple different herds. Is it very common? I don't know. Usually associated with gilt entry or more gilt populations. Usually takes a turn or so, and you're just kind of over it until immunity grows. But again, spinal cord is kind of a key thing. So how do you submit spinal cord? Here's the deal. It's really easy. It really is. All you need is this handy-dandy tool. It's called a Barnes-DeHorner. And you can actually get the entire spinal cord in, I bet, less than 3 minutes. It's really easy. And there should be no more excuses for not submitting spinal cord when it's on the list. Just turn them upside down, take all the viscera out, and basically you're just chewing out the ventral vertebral bodies. And you can open the spinal column up and expose it in a nice fashion, and then after that you could just cut the lift up and cut the peripheral nerves off as you go up the spinal cord, and you have multiple sections to take. Very easy, quick and dirty. Don't worry if you always hit the spinal cord. We don't need big chunks, we just need it for the diagnosis. So I'm going to play this back for you. Here you go. 1, Barnes-DeHorner, it's open, and then you cut it out. Real simple, 3 minutes, guaranteed. Madson said so. All right. We're going to go on to edema disease real quickly. E. coli, usually hemolytic, doesn't always have to be. Usually F18, doesn't always have to be. Proliferates in the intestine, produces a sugar-like toxin, which then is absorbed systemically, causes capillary leakage, and therefore we get the edema. It's a pretty cool pathogenesis. What does it cause? Basically, looks like strep suis a lot of the times, but the indicator that we seem to deal with it is either sudden death or some diarrhea or eyelid edema. Those are probably the most common things we hear or are reported. And I just want to take the time to point out the fact that E. coli is a really cool bug. It can do a lot of different things. You can have straight up diarrhea, you can have just straight up edema disease with no diarrhea, or you can have edema disease with the diarrhea. It all depends on the toxins that are present with that isolate. So don't rule out edema disease when there's no diarrhea, because it can still happen. What do you see? Gross lesions. The most common gross lesions is the eyelid edema. I'm pretty sure you've all noticed that or seen that before. Classically, they talk about gastric wall edema. We don't, or at least I don't see that a whole terrible amount, maybe 1 or 2 times in my career. I have seen mesocolonic edema, though, associated with it a few more times. But far and away, the nicest lesion is probably the eyelid disease. So microscopically, what do you see? A lot of times nothing. It's sometimes hard to diagnose if we don't have the right piece. Typically, the brainstem is probably the best option for us. And we like to actually have a heavy growth of E. coli and then genotype that E. coli and find that the sugar toxin is present before we really diagnose edema disease. The frustrating part about it all is that occasionally edema disease cases, we will not get the E. coli grown from the intestine. There is multiple scenarios or reasons why that occurs, but if that does happen to you, I would suggest resubmitting until we get the actual sample, because it is important to understand what you're exactly dealing with. Salt toxicosis and water deprivation is our next one that happens in the nursery quite often, especially if you don't turn the water on. What do you see? Blindness, they talk about it. Usually it's a down paddling, but it always occurs after you turn the water back on. And it's usually the biggest pigs because they bully their way to the front. So the easy thing to do is if this is the case and they tell you about it, is to just spray the water on the floor before you do anything. And just off and on before you turn the water on full blast. Interestingly, what people forget to do in these cases of salt toxicosis, water deprivation, when they submit samples, is actually get a serum sample. We can do a serum chemistry and actually show that there is elevated sodium sometimes in the blood, so they're dehydrated, and they can correspond that with the lesions potentially or the brain sodium content. What do you see if you're lucky and you're actually looking for it? When you cut the brain in half, you might see some cerebellar herniation. So what the cerebellum is doing is getting compressed against the calvarium, and it's trying to sneak its way out the back down the spinal cord. So if you can imagine, this thing is just starting to turn to mush and trying to go out in any direction that possibly can. That's what you see, because the brain is basically swelling after the water was turned back on. Obviously, eosinophils are an important part of the diagnosis, but generally it all depends on where you're at. And again, elevated brain sodium helps with the diagnosis. This is pretty rare. Selenium toxicosis typically occurs in a feed mixing area. There's often multiple animals affected, but besides CNS disease, paralysis, there's a couple other good indications that you may be dealing with selenium toxicosis, one being diffuse alopecia is possible, hyperemic skin is another one, and coronary band necrosis, meaning their hooves are starting to fall off. All very common clinical signs with this. We don't see it too often, but it's possible. And what the lesion is basically malacia or necrosis of the spinal cord. And where that happens is very important. So your keynote take-home of this today is you need spinal cord, but you need a special section of the spinal cord in general, which is the enteroviruses. I can't say the word, but it's basically where the spinal cord thickens at T1, basically, and at the L4 to S2, where it gets really thick and comes off. That's generally where you see the lesions. All right, so here's just the malacia portion of the spinal cord and selenium toxicosis. Dr. Adam Shelkoff is a nice provider of this email, but these are just video. These are just weaned pigs, 18 days of age, 2 days in the nursery, and what he's seeing is this pig, it can't stand, and its legs are just moving at a constant pace. He's trying to walk and swim. There's no coordination to it, but he can't move. He can't get enough underneath him. There's no nystagmus. He's perfectly fine. He'll respond to menace. If you get close, he'll try to move away. He knows you're there. He's aware. He literally just cannot find the muscles, hint, to actually get up and walk away from us. So, is there anybody that would maybe have a differential for this? Maybe we'll do a quiz. I'm good at quizzes. Who thinks it's strep suis? Who thinks it's edema disease? That's a good one. I could think it may be edema disease. How about Selenium Toxicosis? Probably not. It's not even been on feed that long. Water deprivation? Highly possible. Anybody got any other differentials? Maybe it's non-infectious. What? I'm sorry, I'm deaf. Dang, you stole all the fun away. So, this is actually a, long story short, macronutrients were not being supplied to the sows, so this pig came off. We get the diagnosis. Dr. Shelkoff did a wonderful job of taking every piece of spinal cord and CNS portion, absolutely no lesions. Good thing he did take serum. We actually tested the serum for vitamin D and vitamin A. Both were non-registering on our tests. So at this point, yeah, we know that probably there were some issues with the feed, but potentially a vitamin deficiency can also cause CNS disease or CNS-like disease in the nursery phase. Keep that aware. So if you're going to euthanize pigs, it brings up another good point from Darin, is to collect serum from those pigs and submit that as well. Not necessarily going to use it, but it potentially can help with the diagnosis. And lastly, this is a really cool one, oddball one again, but it's actually seen a few times a year. These pigs are about 4 weeks of age, or 1 week in the nursery. They are vaccinated at placement into the nursery, and 5 to 7 days post-placement, they start dog sitting first, and it progresses to all 4 limbs being paralyzed or pelagic. When you do the brain histopath, there's nothing there. When you actually take the spinal cord, because there was paresis and paralysis, which is an indication of spinal cord, you find pyogranulomatous inflammation, and what happens to be is it's most likely vaccine-induced because they were using too long a vaccine and placing it very, very, very close to the spinal cord. So there's a lot of different things that can happen. Obviously, bacterial meningitis is most common, but just keep your mind open for what's out there, because there's a lot of different things, and it'll go undiagnosed if you don't submit the correct samples. So what you actually need when you're submitting to a diagnostic lab, please, 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 and thank you, nice, good, fresh samples of brain with cerebellum and brainstem, ileum, so we can look for the Haemophilus E. coli, and then spinal cord as our main go-tos for when it comes to CNS disease. So the take-home points real quickly is I really would appreciate it if you used your big doctor words and put them on the form and did a neurological assessment, because it really, really helps localize the lesion and we can have a diagnosis for you. Differentials are pretty vast. Meningitis is the most common, but don't forget other oddball things. I know it's just kind of cool to get a different case now and then, but keep your options open. Don't always hone in and focus on one thing because everything's strep suis and I can move on and go on to the next fire. Take time, do your SOAP, and figure it out. And then sample submission. It is really key, actually, that you get the appropriate samples, especially for these different diseases, because sometimes location actually matters for what we're looking for.